In this talk, I'm going to talk about free body diagrams. And that's a topic that a lot of orthopedic surgeons struggle with. And I've found that the usual reason that they do struggle is because they get confused between anatomy and force vectors. They can't get rid of the anatomy. And I'm going to go through this and explain this as we go through. So in other words, what goes wrong is not the complicated bit, of which there really isn't anything complicated in free body diagrams, but the uncomplicated bit, the simple starting points that go wrong. So what are we talking about when we talk about free body diagrams? Well, first of all, these are an approximate method for calculating forces. They're back of the envelope methods. And the ones we use are applied when the body is in static equilibrium. In other words, nothing is moving in relation to anything else. We assume no friction, and we can only use these if the number of unknowns is relatively small. And we're talking here about two-dimensional free body diagrams. Engineers can do three-dimensional ones, but we're talking about two-dimensional ones. And that's important to remember, for instance, when we're looking at hip free body diagrams. So I'm going to go right back to the beginnings with one or two elementary points that I'm sure a lot of you already know, but this is where people go wrong. So remember that there's a difference between scalars and vectors. Scalars have just magnitude, such as speed or mass, and vectors have both magnitude and direction, such as velocity and force. And that means if we're talking about a vector, we can represent it as an arrow, the length of which is proportional to the magnitude, and the arrow points to the it gives the direction.